Hey guys, Woodruff here. So let's talk about musculoskeletal disorders and do some practice questions that are going to help us dive a little bit deeper, not only just into this content, but in understanding some test taking strategies and applying some real life stuff that we might see on an exam and starting to learn how to critically think a little deeper. So let's look. So first, question one, it says a client with a fracture has 8 out of 10 pain and is complaining of tightness on their leg cast. What priority assessment should the nurse complete? So with a question like this, what we want to consider is first we have to look at the data we have. So we're looking at a patient with a fracture. They have 8 out of 10 pain, and I mean that's kind of high, but maybe expected for this fracture. I don't know. We'll have to see. And they're complaining of tightness on their leg cast. So really, it's saying, what do I need to do next? And so it's asking me for assessments, which means, there's no choice here to call the doctor, et cetera. There's something I need to assess. So it's really seeing if I can associate what assessments are important with a fracture when it comes. If a patient with a fracture is having pain and tightness on their leg cast, what do I need to do? What do you call it? Let's look at our answer choices and kind of start breaking this down. So first I have assess their oxygen level. So, professors love to throw this SpO2 in because a lot of times you guys go into ABCs, you're like, oh my God, got to check the oxygen level. It has to be this, but not always necessarily. So when it says assess SpO2 level, like obviously it seems like something I would want to check, but it seems like they got a fracture and they've got a problem on their leg. So I'm thinking it's probably something associated with their leg, but let's keep going. Like I don't like pretty much what I want to think about is which one of these assessments is going to give me the most information that's going to help me to make a decision about what to do next. Like which of these which information do I need before I call the doctor if there is something wrong, or where am I going to find out if there's a problem in this patient? And I mean, yeah, if their SpO2 levels off, that definitely would be a problem. But am I thinking a patient with a fracture with tightness in their around their cast is going to be having a problem with their SpO2? Not necessarily. So then there's assess the client's blood pressure. This is another one. A lot of times it seems like, ooh, I need to assess their blood pressure. It's going to help if I know what their blood pressure is. But you have to think about it. Okay, well, probably their blood pressure is going to be high if they're in pain and they're having this tightness feeling. Like, I don't know if that's going to tell me, give me information of stuff I need to go right now. It's not really about their leg. This one says check dorsalis pedis pulse. Now I like this one because it's about circulation. And I know stuff with fractures is a lot about circulation. How are they getting perfusion, etc. So, I mean, I'm liking this answer, but I'm going to keep going. Assess skin around the cast. So this is kind of hard. I kind of want to check the skin around the cast because if they're complaining of tightness, but this, when it comes down to it saying priority assessment. So this is why usually in a priority assessment question, there's going to be 2 answers that are pretty good, but then I have to get, excuse me, getting a little crazy here. What do you call it? You have to think about which one of these assessments is going to give me the best or most important information that's going to help me to make a decision. So in order to know that if I had some knowledge about fractures, I would know that having increasing pain and tightness around the cast is a sign, an early sign of compartment syndrome. And compartment syndrome is all about circulation. Assessing the skin around the cast might tell me if they have infection or something else going on, but there's nothing in this question about infection, skin breakdown, anything like that. But all they're complaining of is pain and tightness in the cast. So I'm worried about their circulation. So then I have to ask myself, which of these best tells me about circulation? And if I had to choose one, the only one that really has to do with their circulation in their leg is going to be C. So I want to check their distal pulse. Because I want to be able to see is this pain and this tightness to the point where it's impairing their circulation. So this is going to give me more information, and I can take that information and then based on that, and probably I'll need to do more of a peripheral neurovascular assessment to see what else is going on. But C is the best answer here. Question 2. A nurse is caring for a client in skeletal traction for a femur fracture. What finding is most concerning? So here's another one of those most question that you guys hate, where it's asking like, hey, like what's most concerning? And it means like all of these can be concerning, but which one is scariest to you? But really it's trying to help you, it's trying to ask you or assess your ability to judge whether something's expected or abnormal. And then even if there's multiple unexpected things, which one is the scariest or most severe? So answer choice A says a small amount of clear drainage around pin sites. So, you know, what I can do as I'm reading these is because I have to know about skeletal traction. It's a fracture, okay, but really this question's asking about skeletal traction. So I also can think about, let's say I didn't know that much about skeletal traction, which of these sounds the scariest? I can also use that. So let's see. So first we have clear drainage around the pin sites. Well, they have some drainage, but it's clear. I like that. It's not purulent or yucky or anything like that. That'd be funny. A small amount of yucky drainage. I'm sorry, I'm not using professional words. A small amount of, you know, if it said purulent, if it said, you know, maybe like sanguinous, like they were bleeding, I'd be a little worried. The other thing in here is it says a small amount. So there's not a lot. So like, you know, it's saying small and it's clear. Both those things aren't very concerning to me. The next one says client complaining or is complaining of 5 out of 10 pain at the fracture site. Well, 5 out of 10, that's not incredibly severe. It's maybe something I might want to look into. But again, I don't know if it's the most concerning thing. I have to keep going. The nurse smells a foul odor coming from the client's leg. Now this kind of puts my spidey sense up because there's a foul, like I have to ask myself, for another way that I could word this question or go through these answer choices that I could ask myself for each of these, like, you know, is there something abnormal here? So like for this, I could ask myself, is it ever possible or is it acceptable or is it normal to have a small amount of clear drainage? Is it like, yeah, probably. Is it, you know, acceptable, possible for them to have 5 out of 10 pain at their fracture site? Yeah, it's very possible. It's probable. They have a fracture and they're in traction. Foul odor, though, is there any reason that's normal or acceptable or, you know, expected for a client with a femur fracture to have a foul odor? And there really is no reason ever for a patient to have a foul odor coming from them, because foul odor, you should think infection. So far, C is my best contender, but let's keep going. Then client has a 2+ dorsalis pedis pulse on bilateral lower extremities. Well, 2+ is normal, so that sounds great. So that's not even concerning at all for me. So I'm going to cross that one down. So then I'm down to A, B, and C. And like we said with A, it's small and it's clear, not very concerning. So if I cross that one out, then I'm down to between B and C. So what's most concerning? Is it that they're having 5 out of 10 pain or that there's this foul odor possible infection? So, you know, I might need to do something about their pain, but immediately I need to do something if there is, because again, they could have 5 out of 10 pain. That's, you know, expected. It's not severe. It's not new, different, worsening. It's 5 out of 10 pain. And then, but a foul odor, there's absolutely no reason for a patient to have that. So I need to take action right now. So C is the correct answer. All right. So it says a nurse is observing a client with chronic back pain lifting some belongings. Which action by the client would warrant further education? So it's talking here about what is going to say? You know, we have to first look, what's the disease process, chronic back pain, and what's going on. They're lifting some belongings. So pretty much this is asking about appropriate body mechanics for a patient. And in a question like this, an education question is either asking what is showing they understand, so they're doing it right, it's good, or what is showing that they need more education, or what is bad. So we have to always ask ourselves, am I looking for what's good or am I looking for what's bad? So this one is saying would warrant further education, which means they don't understand what they're doing. So 3 of these are good, then 1 of these is bad. And so we want to find which one is the bad egg. So the first one is client lifts object above head to storage cabinet. And like I find for body mechanic questions, it helps me to actually visualize it. So if I'm sitting there, I'm thinking, that kind of hurts my back to do that. So I don't necessarily know that that would be helpful lifting above my head. But let's keep going. We're only on the first one. It says they bend their knees as they lift an object from the floor. So, and I'm not getting down and doing squats. Mama's too old for that. But it says that, what do you call it? I have to go back to my principles and I have to think about, you know, when a lot of the bending stuff, it's all about using your big muscles versus your back. And so I have to think if I bend my knees to lift an object from the floor versus bend over, and that's probably going to be better for my back. The next one says client keeps belongings close to their body while lifting. So I have to think about if I have an object close to my body versus out. Out kind of feels like a strain. If I'm lifting something up, this feels like a strain versus this. That's really awkward to do that, but yes, never mind. This is a very strange thing, and I'm going to stop right now. But that was I need a box, apparently. I think I have a box in here too, maybe the textbook, but you get the point. I'm not going to keep being weird. Well, I'm going to always be weird, but I'm not going to be weird in this moment. So it says they keep their belongings close to their body while lifting. So I think keeping them away from your body would cause more strain versus keeping something close to my body while I'm lifting. So client stands with feet hip width apart while lifting. So I have to think about, okay, is this going to really provide them the support that they need? If the feet are hip width apart, that's probably going to give them a good balance to do it. So far I like B, C, and D, but the only one that didn't sound good was A, that lifting the objects above the head. And so this is the correct answer that is incorrect, because we do not want them to lift objects above their head, because that's going to cause strain in their back. We do want them to bend their knees. We want them to keep belongings close to their chest. We want them to stand with their feet hip width apart when they lift. Question 4. Nurses reviewing labs and diagnostics for a client with suspected rheumatoid arthritis. Which result is most consistent with this diagnosis? So the first choice is a white blood cell count of 8,000. And so, oh, sorry, let me back up real quick. I'm jumping right in. This is what sometimes students do too, is they jump right into the answer choice. So we're looking at labs and diagnostics, and then it's suspected rheumatoid arthritis. So I don't know what it is yet. So it's pretty much asking me which of these diagnostics is going to give me the most information or is most connected. So pretty much I need to ask myself, which of these diagnostics can I look at and say, hey, it is a pretty good chance that they got RA. So the first one's white blood cell count 8,000. Well, this is a really general lab. Someone could have a white blood cell count of 8,000, and that's normal too. And so if they have that, that could be normal. So I don't know how I could get I have to ask myself, could they be diagnosed with rheumatoid arthritis based off of a white blood cell count of 8,000? I don't think so. The second one is negative RF factor. So I like the RF factor because that's rheumatoid factor. And I think that I should have just put negative RF instead of a negative RF factor. So yeah, but I think you get the point. Anyway, but it's saying negative. So to me, that's so what can happen here is if you read too quickly, you could just see that rheumatoid factor there and be like, oh, this is right. But it's saying negative. So I think with rheumatoid arthritis, they have a positive rheumatoid factor. The next one is osteophytes on the X-ray. So this is where, again, a lot of questions that are looking for they're talking about what symptoms or what diagnostics. They may give you an answer choice that's wrong, that's correct for another similar disease process. So what's similar to rheumatoid arthritis? I have to think about osteoarthritis. And so some of the things I might want to ask myself is maybe these are specific to a bone disorder, but is it RA? I think osteophytes have to do with osteoarthritis. So osteophytes, osteoarthritis. Those are those bone spurs that we can see on their x-rays. And last but not least, we have straw-colored synovial fluid. So one, I'm out of choices. I think this probably has to be my right answer, but let's see that it makes sense too. Because sometimes you can end up accidentally selecting, crossing something out, and then you go back and you're like, wait, what's my answer choice left? So I have to make sure that this is right. So synovial fluid, that's the fluid that's in the joint. And if I remember with rheumatoid arthritis, it's an inflammatory process. And so as a result, they can have, it's inflammatory in the joint process. And so as a result, they can have inflammation in their joint, obviously, and signs of that, but they also can have changes to their synovial fluid. Normally, like people with osteoarthritis, they're going to have clear synovial fluid. There's no inflammation going on. But with rheumatoid arthritis, they have an inflammation. This is an autoimmune disorder. So the correct answer here, that does make sense. So straw colored or yellow is going to be that sign of inflammation in that joint space in that fluid. Question 5. A nurse is caring for a client with gout. Which order would the nurse question for this client? So the first option is bed rest. Oh, here I go again. I went really fast. So client has gout. Which order would the nurse question? So we have to think about so pretty much I'm looking at which of these is not safe, because it says which would I would question. It's not just saying, hey, what's not appropriate. If it asks if I would question it, it's really asking me is which one of these could cause harm to the patient if I do it. So then I want to ask myself, if I put the patient on bed rest, would it cause harm for a patient with gout? Patient with gout, they have that inflammation of the joint, super painful. They have what do you call them? Those TOFI or TOFI, however you say them, on their joints, and it can really lead to a lot of discomfort. So I think bed rest would be appropriate. I can't see how bed rest would hurt a patient with gout. I know with other types of arthritis, we want to get them moving, but I think with gout, we want them to slow down or stay still. Answer B is fluid restriction. So patient with gout has extra uric acid. And if they have extra uric acid, I would think a fluid restriction could possibly be a bad thing, because I'm thinking if you have, anytime you have too much of a particle in your body, usually you want to flush it out. So I don't love fluid restriction, but let's keep going. So the next answer choice is C, which is a BMP daily, which is a basic metabolic panel. So I don't know necessarily that, that it's like a must have, but I have to ask, could this cause harm? Is it like, maybe is it necessary or it's not? I don't know. But a BMP, let's remember what's on a BMP. First, there's electrolytes. I don't think anything with gout has to do with electrolytes. There's also, though, kidney function. And I think that uric acid, gout, kidney function, they're all related. There's something about the kidneys and gout. So I think that having that daily, I wouldn't question that, because we may need to know what their kidney function is or what's going on with their kidneys with gout. The last choice is application of ice packs. So if I apply ice to someone with gout, would that be painful or painful? Would that be harmful? And I have to think with most types of arthritis, ice packs for pain is helpful. So I don't think that ice packs are a bad thing. So that leaves me only with my answer choice B, fluid restriction. And like I said, that the reasoning there for fluid restriction is that with patients with gout, they have too much uric acid. So it's an overflow of something. So, and it also can clog their kidneys and it can lead to some kidney damage. So I really like to support healthy kidneys and also dilute some of that extra uric acid and help flush it out of the body by, they usually have increased fluids. We don't want to decrease their fluid because one of the precipitating factors for a gout attack can be dehydration. So I do not want to do anything that's going to dehydrate this patient. So question 6, a nurse is caring for a client with fat embolism syndrome. Which treatment is most appropriate for this client? Again, woman, most appropriate. I know I'm a horrible person making these questions. So, so difficult. So they have fat embolism syndrome, which has to do with fractures. And we're trying to see which treatment is most appropriate. So it says most appropriate. It's really asking what's most specific, what's going to be most helpful, what's going to be most direct. So I have something going on with the fracture. It's a fat embolism. So I think when I hear embolism, I think like pulmonary embolism, but it's fat. So there's fat floating around in my body. So what's going to be most appropriate? All right, let's look. A, remove any constrictive cast or dressing. So again, this is kind of one of those things where a lot of times when they ask what's most appropriate, sometimes it's something that's appropriate for something similar, but not exactly the same. And when I see remove any constrictive cast or dressings, I think about compartment syndrome, but not fat embolism syndrome. So I'm going to keep going though. I'm going to keep it on the back burner. Elevate affected extremity on a pillow. This is talking about fat embolism. There's some fat floating around in my body. I don't see how elevating the extremity is going to help because this is not an extremity problem. Compartment syndrome is an extremity problem. Fat embolism syndrome is more of a systemic thing. I don't think that's going to necessarily help, but I'm going to keep going. Place client on oxygen to keep saturations greater than 95. Well, I know that when we have pulmonary embolisms, that's an oxygen problem. I wonder if I had fat free floating around my body, if I would be worried about their oxygen saturations. I kind of like that one, but let's keep going. Administer intravenous pain medicine. So again, I feel like this is more appropriate to compartment syndrome because with fat embolism syndrome, I don't think there's any pain associated with it. It's fat that's floating through my body, getting stuck some places. I don't think that it actually leads to any pain. So the best answer here, because A, B, and D are more appropriate for compartments or most appropriate for compartment syndrome, C is the only one that's specific to fat embolism syndrome. And just to remind you, so what happens in fat embolism syndrome is either as a result of, what do you call it? They either think it's the trauma of the injury or sometimes like hormonal or chemical things that happen as a result of a fracture. Fat particles can get dislodged and free float in the body. And sometimes these are little tiny particles and they get clogged, and they tend to get clogged in my airways and then in my brain. So usually the two manifestations of fat embolism syndrome are going to be respiratory and they're going to be neurological. So I really want to think about with these patients, we call it, those assessments are going to be my priority, the respiratory assessment and neurological. And then the interventions that are going to help us to support their oxygenation and breathing. Maybe remember we talked about diluting things when you have too much. So maybe some fluids, support their blood pressure and stuff, and then keep them safe because they could be confused or have a decreased level of consciousness. So let's keep going. Question 7. A new okay, let's try again. Nurse. I swear I'm not having a stroke. A nurse training a new graduate RN on a neurovascular assessment. A nurse is training a new graduate RN on neurovascular assessments for clients with fractures. What information should the nurse include in her training? Select all that apply. Favorite kind of questions, right? So a nurse is training a new nurse, and they're training them specifically on neurovascular assessment. So neurovascular, so everyone kind of gets confused by this. It says neuro and then vascular. So it's not just a neuro assessment. It's not neuro like this. It's neurovascular. So it's talking about my 6 P's and 1 C. So it's a client that has had a fracture. So what should we include? So we have some fun here with the select all that apply. So let's do this like a true false. So for a neurovascular assessment, do I palpate their dorsalis pedis pulses? So I have to think about what P is that? That's P for pulse. So that sounds correct. So I'm going to go for that. So that's A. Number B. I think that this is like, when you watch these videos, I always wonder if people down the line watch these videos and literally wonder, like, is she okay? And I am okay. Letter B. I'm just a little kooky in the head, kind of always. So letter B says, assessing temperature of lower extremity. So I have to think about my 6 P's and 1 C and what does that have to do with? And so that P is going to be poikilothermia. And so poikilothermia is all about temperature. It's about like how warm or cold. Because really, when you think neurovascular, you should think about blood flow. So these are all the assessments that are going to tell me how well my blood is flowing to my extremities. And so we caught what my pulse is, how well that I have a pulse in my foot is going to tell how well I'm getting flow, what my temperature is, because if I'm not getting good blood flow, I'm going to have an alteration in temperature. All right. So next one's asking orientation questions to the client. So this is where a lot of times we can get students because it's like, ooh, orientation, it has neuro in it, but neurovascular is not about up here and blood flow up here. It's about blood flow to my extremities, like my feet and my hands. So orientation questions are not going to be a part of neurovascular assessment. Next one says checking capillary refill of bilateral toes. So that's the C in the 6 P's and 1 C, capillary refill. Because again, this is another flow thing. It's going to tell me how well things are flowing. Because what I should get is it should be blanchable. Like I put pressure on it and I let go and I should have a return of color. This shows that I am getting blood flow. Next one is calculating Glasgow Coma Scale. So this is another one that's specific to neuro, but it's not neurovascular. So maybe for a client with a fracture, I might need to check C and E, but they're not going to tell me specifically about a neurovascular assessment. So that's what you always have to ask yourself is maybe this is appropriate for a patient with a fracture, but not necessarily for a patient when we're specifically saying what's a neurovascular assessment. The last one is ask the client if they have numbness and tingling. And this would be the P for paresthesias. And so this would be another part of it. We want to know if they have numbness and tingling because it's the same thing like when you fall asleep on your leg or something and it gets bent and you kind of get that like pins and needles sensation or that falling asleep sensation. This is the same thing. It's a sign of decreased flow. So the correct answers here are going to be A, B, D, and F. So C and E are incorrect. So 8, which of the following statements by a client increases their risk for carpal tunnel? So this is a risk factor question. And so each of these might have one or more risk factors in them. So with risk factor questions, I always want to count who has the most risk factors out of these choices. So Let's look at the first one. The first one, it says, I enjoy exercise and like to go swimming. I mean, I don't really see anything wrong with that, but I have to ask myself, what do I know about carpal tunnel? Is it as a result of too much exercise? And I think with carpal tunnel, it's like a repetitive strain. So it's from them doing something over and over. So if they enjoy exercise and they like to go swimming, it's not necessarily a repetitive, like, because carpal tunnel is in your hand. So I don't really see that as a repetitive movement that could cause carpal tunnel. Second one is, I work at a desk job and use a computer often. That 100% sounds like carpal tunnel, but it kind of sounds very Hallmark. But sometimes this is what students can do is they find an answer. They're like, oh, it has to be this. But let's keep going because we want to make sure all, you'll have to, if you have the time, you should always check to make sure all the answers are incorrect. Sometimes you read an answer, but you read it so quick and there's something wrong about it and you don't read the other choices. Make sure your other answers are wrong before you select your right answer. So I have rheumatoid arthritis in both my hands. So having rheumatoid arthritis can cause problems, but I don't know that rheumatoid arthritis and carpal tunnel are necessarily closely tied or connected like that. The next one says, my mother also has carpal tunnel syndrome. So it's really asking me, is carpal tunnel genetic? And carpal tunnel is repetitive strain. I don't think it's genetic. So really, I would get down to A and B, and which of these activities would be more repetitive or put them more at risk. The one that's more related to like the fine motor of the hand is going to be the desk job and the computer. So I'm going to say B is the correct answer. And it is. So people with carpal tunnel, other people that would be at risk would be people like musicians, people that are factory workers that do the same hand movement over and over, or checkout clerks, things like that. But it's people that do repetitive hand and wrist movements that are going to be most at risk for this. All right, last but not least, nurse is caring for a client with right lower extremity below the knee amputation. This client is complaining of 10 out of 10 pain to their right foot. What is the most appropriate response by the nurse? Ooh, so this is kind of a knowledge question because it wants to know, you need to know, is this expected? Is this okay or not? But it's also a therapeutic communication question, which I know that everyone hates psych. Some people like it. I'm not judging psych, but some people, most students hate these kind of questions because they're like, what am I going to say here? So they've had an amputation. They have 10 out of 10 pain. So what's the most appropriate response? So if I read this question, I know about amputations, I would know that, one thing I need to know is that they can have phantom limb pain. If they're having phantom limb pain, this can lead them to experience pain even though their leg is gone, et cetera, or, wherever their amputation is, that this limb is gone. So I'm really thinking about what's therapeutic and what is correct too, because usually with these questions, with these kind of answers for these kind of questions, we want to see something that's true or appropriate, but also kind and therapeutic. And so let's look. So first, and I guess I didn't make these A, B, C, D, but you get it. The first one says, did you mean to say your left foot is hurting? Well, that's rather insensitive. So they're like, hey, my right foot's hurting. I'm like, oh, you sure? And so that's not really sensitive. I don't really like that. The second one is, let me take your covers off so you can see your leg. So, I know they do that mirror therapy and they let them kind of look and stuff like that. But I don't know that that's necessarily, someone has 10 out of 10 pain and I'm here, look at your leg. I don't know, that's really therapeutic at that moment. They might need to do some therapies, but I don't know if at this moment it'll be the most helpful. It says your pain will get better if we reposition with a pillow. So I know with the amputations, we don't want to elevate on a pillow. So I don't think that's a good answer. And they have 10 out of 10 pain. It doesn't really seem to be addressing it. Just like, hey, let me reposition you. And the last one is, I will go and grab some pain medicine for you. So out of all of them, this seems like it's going to be the most helpful and most therapeutic. And it's something to know about phantom limb pain, even though we're looking at them and we're like, the foot's not there, the leg's not there, whatever, it's still, that pain to them is real. They are physiologically feeling it. They can have all the symptoms. They can get tachycardic. They can start having the respiratory rate can increase. They can start having all the physiological symptoms of pain, extreme pain, without actually having that limb present. So we always want to be respectful and, when a patient says that that's the pain that they have and we have medications to give for that, we've discussed their plan with the physician, that it is appropriate to give. Some of the other stuff might be appropriate at a later time, but, it's not our job to sit there and be like, look, your foot's not there, that's so, it's inappropriate and it's not going to help. While we do want to advance and help their care, there's going to be therapists and people that they work with. And I'm talking about like physical therapists, occupational therapists that are going to help them to deal with some of the, emotions and stuff that surround this. And there are therapies like mirror therapy and other therapies they can use to help to connect their mind and tell their mind, hey, because like when they have phantom limb pain, their mind has not connected that foot is gone. So regardless of how much we can sit there and tell them, hey, it's not there. Hey, it's not there. Oh, you're wrong. It's the other foot. We really have to think about their brain literally still thinks that their foot is there. And so as a result of that, that pain is 100% real. So we always treat their pain first. And then, yes, we're going to do some of these other things, but the most appropriate response in this moment, 10 out of 10 pain, is to get to the bottom of the pain. And the most effective intervention for someone who's had an amputation, which is a major surgery, is going to be to get them some pain medication versus just reposition. Because answer choice C is also not appropriate because it's not just reposition, but it's on a pillow. Or with a pillow, and we do not like them. We worry a lot about flexion in people with amputations. If they have too much flexion, it can lead to them having contractures as a result of their amputation in their hips, etc. Anyway, I could go on, but I think you're probably tired of hearing me ramble. So I'll see you for the next one.